Welcome, everyone. Hi, Alicia.
Hi. Hello. We love seeing you guys announce where you're from. Thank you for doing so. It's so exciting.
Yeah, we had a little, seems like our technology is glitching all at once. So I'm on my laptop instead of my big desktop with multiple monitors. So Alicia's going to drive the slides tonight. I'm going to be her Vanna White, checking the comments in the chat. So if anyone has questions as we're going along, go ahead and type them in there and I'll pull them up on the screen and Alicia will see them and be able to
That's right.
answer. So how's your week, Alicia?
It's been fantastic. It's one adventure after another, I have to say. I'm also not at my normal office. And so it always, when you change things up, it takes a little getting used to. But you know what? It is so much fun, like I said, doing these and also getting the feedback on how the webinars that we do for you guys actually helps you. So please share with your peers, your friends, your coworkers about CCO, and let them know that we are here to help educate them in this particular area. We're doing something kind of new tonight too, which I'll let Laureen talk more about that. But we have our CCO Club webinars. As you know, we're ramping up to start doing more webinars for you. We get a lot of requests for them, and it's been a while since we've been in the trenches doing as many webinars as we had in the past. But we do know that this is what you guys appreciate from your feedback, and again, we like that feedback. The CCO Club webinars are unique in that it's questions that people ask, and then we go do the research or get resources for you to answer some of those questions. So again, tonight's a club webinar.
We should give a shout out to our interns and to Sylvia, who help vet the slides. So our interns do the first stab at a lot of these topics, and Sylvia will be our subject matter expert as our in-house coder, and then Alicia and I present the final product. So I want to give everyone credit.
Absolutely. And we'll talk about interns again in a little bit. So if that's something that you're interested in and is being an intern with us, we're going to round back and talk about that tonight as well.
Some of the questions in the audience.
Oh, good, Sylvia. Yeah, Sylvia just came back from vacation in Florida here about a week or so ago, right? So she should be bright-eyed and bushy-tailed. Yeah. Or overwhelmed with being gone and the rest of us trying to do what she does. She's so good at it.
Yes.
The questions that we get a lot of time are ones that surround what do I need to do? But, I got my certification or I want to get into the industry. What actually do I need to do on those ancillary skills? What type of skills do I need that will make me a better applicant or a better employee or help me get my foot in the door? And when we sum up what we do, because there's so many avenues that you can go into, both with coding as well as that business side of medicine, that it can be pretty broad. So we generally call it health information management, or HIM, when we're talking about kind of a global arena of what you can do once you either get certified or you start picking up some of those skills in our industry. Now, ideally, what we would like to see you do is pick up a coding credential, but there's other credentials out there that you can get that could be a stepping stone or part of your journey or your path. So we're going to talk a little bit about all of that to kind of open up your eyes as opportunities that you may not have been aware of. And with that, what skill set do you need to have to really be good in that area? Because we continue to learn, and that's reiterated again and again tonight. We not only continue to learn on the soft skills that we sometimes just acquire with age, or that those little more advanced skills where it maybe is being a team lead or organizational, from supervisors, managers to directors, stuff like that. And what you may think that you wanted to do when you started and you get into the industry may change. Lorraine and I can both tell you that we've, maybe stayed in medicine, but we've had a pretty multifaceted career up to this point. And quite honestly, we could shift again and make lateral moves if we wanted to, because this global arena that we work in is kind of this ever-changing behemoth of opportunities. And this is a great time to get into the HIM industry. The four main things that we're going to talk about is we're going to look at kind of an overview of the HIM careers. And I gave you kind of a slight introduction as to what we were going to go over. Some core skills for the HIM professional. And we'll open that up maybe to both behind the scenes with experience that I've had, and maybe Lorraine too, on some of those skills that or programs or things that might make you a better applicant. Supplemental skills to boost your HIM career, and skill building strategies for the summer, because that's where we're at. Sometimes, especially if you're going to school, you take a break in the summer. And so it's an ideal time to kind of step back, focus, and find out where you're at in your journey. And if there's an area that you need to pick up an extra knowledge base in, it's a good idea. It's a good time to test your skill set. Well, really with HIM, and again, that's health information management, you have to know that it's a hot career. Anything in medicine is really, not only is it hot as far as career wise, it's sustainable, it's long lasting, it's always needed. It is one of those areas that you can get into with a high level of education or a smaller level or introductory level, and still build skills and increase your opportunities that could be available to you. It is not a career that's ever going to go away. There's a couple things that healthcare, getting into education, getting into service, things like that are skills sets or careers that will always be around and have a pretty much a set rate of pay. You know what you're getting into, and you can pretty well rest assured that most of the time you'll have a good work package as far as benefits are concerned. Just a little bit of a history, the growing demand for HIM professionals, they've had a 16% growth that's going to be projected from starting in 23, which we're past, all the way up to 2033. So again, it's a slow climb. It is always increasing those opportunities. Importance of HIM in a modern healthcare, it's the started to say that wrong, so I may stumble over it again. Digitization, data security, and compliance. These are three areas that you may not have thought of that are big, major players in healthcare. Now, we've talked about the maybe the business side, but the data security and compliance, we don't talk about that very much, and it's an integral part of what we do. Career versatility. No, did I say that right, Lorraine?
Versatility. Oh, I hope I don't have trouble tonight. I did all day have trouble spelling things, so my brain may be glitching. So from technician
to manager roles. I have to say that one thing that's unique about healthcare is that once you get into, say, an entity, if you're going to work for a major health system that's in your area, or even working remote, which is more available now than it's ever been in my lifetime, that there are ways that once you've got your foot in the door, they like to hire from within. Almost everybody likes to hire from within. So you could start as, as they used to say, in the mail room and end up being a CEO someday. It truly still happens in healthcare. And we are going to talk about degree programs and how that is an important part. But again, there's not many careers where you can slowly take that ladder up like it's in healthcare.
Alicia, can you go back one slide? Someone had a question. I thought this would be a good point to try and answer it. Humble Presidents asks or states people are scared to get into health information management out of fear of being replaced by AI. I had a little something to say about that because I actually work in my day job for Solventum, and that's basically what we do is we do CAC coding, which is computer assisted coding. And I did it long ago when it was CodeWrite, and then it was bought by 3M, and now that's spun off to Solventum. So I've been, with them on and off throughout the years. And that was always the fear of all of the coders that we would go to. And that didn't happen. What it did do, though, is elevate coders to a management type of role. So in a way, we audit what the computer assisted coding is suggested, or in the future, it could be purely AI. Right now, it's more like kind of rules based and maybe a little bit of machine learning. But I think we're very far off from being completely replaced. I'm not going to say that would never happen, but I don't think it's anything that if you are in the career field now or looking to get into it now, I think you have a good long shelf life before you're ready to retire. But it's just going to augment what we do. Similar to when we got online coding manuals. Coders thought that was going to replace them, but it was just a tool. Just like with cooking, you wouldn't say, well, I don't want a dishwasher because, or I don't want a microwave. We embrace those tools to make us more efficient. You might have, if you have a huge, like maybe 20, 30 coder team for a billing company or a large facility, maybe they might cut 5 people. That's a possibility. But there are other jobs where you will use your skills as a coder because AI still needs to be vetted. You still need to double check it. So I just wanted to say that. What's your thoughts?
I was going to, from a different area, working for a large health system, a large entity that is also a teaching institution. They use AI already. And however, it has not affected the coder in any way. They're still demanding coders, and they're always shorthanded on coders. What it is doing is it's working in analytics. And so the coders are still needed, but what it allows is us to do amazing reports and to find the benchmarks and the areas in which we need to do education for the clinicians or education for the coders. So it sees things that we may not pick up on or trends. And that's just in that area, not including so many other areas, the financial aspects. So the AI is not going to be an in the trenches coder, in my opinion, and what I'm seeing so far. It works in analytics. It has helped with the clinicians or the providers. That's interchangeable terminology, that to help them with some of their documentation. But even if it abstracts from the documentation to pull in a code, that never gets released without human eyes going over it. So as Laureen said, it will elevate what you do. However, it's just going to make your life a little easier. And it's only as smart as the data that's put in. So if we aren't coding to the highest specificity, then it's not going to be able to capture that. So yes, CAC and all that, that's here to stay. But think of it as going from, our flip phones to our smartphones.
Yeah.
That didn't knock out the users,
Yeah. But it does shift things, and it is something to think about. And you should just put that on your list of things that you want to master and become really good at understanding AI and the different models that are out there. And there are autonomous coding, which the goal is to bypass human coders, but that'll never be 100%. You will always need human coders, and you need human coders to train it, and human coders to do a percentage, where you pull out and you QA it. So only like the easy kind of cases, like, single view chest x-ray cough, like the chances of it getting that wrong are very, very slim. So, but your VIR, you're probably going to need human coders to check all of those vessels, but it certainly can highlight the language and make things jump out at you as a human coder so that you don't miss oftentimes a lot of the lost opportunities that are left on the table, which is when, like Alicia and I do audits, that's what we find a lot. The coders, they assign correct codes, but they missed some gems that were in there because it wasn't like maybe on the procedural statement line, but it was buried in the report. And that's revenue that they deserve, but it just didn't get reported and billed out. So go ahead.
Another thing that AI can do that we don't think about is not necessarily on the coding, but on the billing side. The different payers, they have so many rules, and for pre-auths and everything. The AI can jump in and navigate that quicker and go through the analytic part of how come we're not getting reimbursed for this procedure by this payer, but we are on this payer. What guidelines or rules does this payer have? AI can jump in and run through that quickly, whereas it would, take all day for a human to do that. So it really is a tool, and I see it in my world right now. It's all on the analytical side, and that may be an area, analytics, that you want to get into. In fact, if you're looking for a job in the future, you may want to write down the term analytic, because that is what you'll find a lot in job searches, is the analytics side. So I encourage you to do that. Honestly, Laureen and I have both been in the industry from different avenues and still in the same industry, but doing different things for so long that, you can put a comment in the CCO Club and ask us anytime if something looks like it's in that arena. We can help you with verbiage and terms to look for, because sometimes just finding a job is knowing what the correct verbiage to search. Now I just want to do a quick, did you want to say something before I did a commercial?
No, you're doing good. I was going to say, maybe after this, if you could talk a little bit about risk adjustment, because for the new ones that are joining the call, that are maybe considering this as a first-time career, which one do I go for? And I used to recommend the CPC, which is CPT, procedural coding knowledge and diagnostic coding knowledge. But if you're just starting out, sometimes the risk adjustment is actually a better first step, because you only have to deal with one coding system, and that's ICD-10.
Correct. Yeah, that is correct. So just as a quick commercial, and let you know what's happening at CCO as we go through this. If you're not already aware, we have an amazing opportunity through our CCO Club. And if you want to know more about it, it's real easy to find. Just type in the cco.us/club. What that allows you to do is once you get involved is you get all of these webinars that we do, but not only that, you get the slides, you get the transcript, you get the discussions that we have afterwards, all at your fingertip. And a lot of times we get questions after a webinar that we start discussing different things, like that verbiage that might be what you need to use to look up a specific job and risk adjustment or analytics, so on and so forth. So it's fun. It's real intuitive, easy to use, and it's a wealth of information that allows you to link with your peers or other, people that are just starting out or people that's been in the industry for a long time. We have people that are brand new. We have people that have gone through several of our courses that keep coming back for more information. And then we have people that are out in the industry that just need help with research, or they need a tiebreaker you have a discussion on how to code something, and 3 different people want to do it 3 different ways. Do we have an opinion or a resource? So it's exciting and a way to learn, but it also keeps you in tune to what's happening in the industry. So I look forward to you guys reaching out to us.
We forgot one thing. What does everyone want?
CEUs.
CEUs.
Yeah. How can I've missed that? Yeah, it wasn't on there. It's over in the corner.
Yeah.
You're right. And after you get certified, we need X amount of CEUs every 2 years.
Continuing education.
And so those CEUs are available in the CCO Club, and they're applicable to what you're doing in the industry. Sometimes, searching for the CEUs can be difficult. And then when you do find them, it's so boring that, it's drudgery. But ours, I would have to say, are exciting, fun, and pertinent to what you're doing in the industry right now. So,
and we are putting all the CEUs in the club only. We're not doing live CEUs anymore. So what we do is when we're done with this video, we have a whole process and we submit that to get the CEUs, and they show up in the club in a couple of weeks. And so you just take them when you're ready, go at your own pace, and you can just kind of go through them. We have them all stacked up with the most recent one that's going to expire and the new ones underneath. So you always have a fresh supply of CEUs to get. And we're trying to keep them. We do have like a little mini course, which is, I think, like 9 CEUs. And,
right.
But most of them are 1 CEU at a time. So they're kind of easier to consume. A little quiz at the end, like a 10-question quiz to make sure you got the key points. So come join us in the club. And for those who are with us, who are club members, thank you very much.
Yes, I do a shout out for all of you guys that are already CCO Club members. I'd like to see how many are taking advantage of picking up live content. It's always fun to be engaging.
And we're having some changes coming up. We haven't decided if we're going to do it effective September 1st or January 1st. But our annual club members are going to be able to get the access to previously purchased courses.
Yes.
We're going to stop offering it to the monthly club members. So if you're currently a monthly club member, stay a monthly club member to keep that benefit. But going forward, we're going to only offer that to the annual club members or students who are just coming off their 9-month course. They will be allowed to do the monthly, because sometimes they just need a few more months to finish. So
these changes and stuff are us adapting to changes in the industry, as well as feedback that we've gotten from you guys, how you would like for us to be able to offer the content that we do. So
all right.
Thank you to you guys who give us feedback. So moving on, what is HIM, or Health Information Management? It is pretty broad, but ultimately you're managing patient data, and that includes the medical coding, that includes compliance and the analytics. Like I said, analytics is a huge part of what we do. And in the past, if someone told me that I would be working in analytics, I would have said, absolutely no way, because that's not the way my brain works. I don't have an analytical mind. But honestly, the fact is we don't have to. analytics is just taking the data and, weeding out the information that you need. And so it's actually pretty fun. And there's so many great tools to do it that it's relatively easy now. The computer does it for us, and then we adapt to the needs based on the analytics. So if that is something that you think that you're interested in, then you're in the right place. I can tell you that. Some of the roles that you might not be aware of. Now, of course, we know HIT or HIM, health information technician. That's usually a stepping stone, a first rung in the ladder in the industry. You've got medical coder, of course. You could also get into billing, which would fall in the management. A lot of times the analytics will also play a huge part in the business side as far as financial side. Even if you started in medical coding and you thought, well, this is what I thought I wanted to do, but you're exposed after you get employed in some of the meetings that has the financial aspect to it, that would be a lateral move. And there's some people that really thrive on that. There's also clinical data analyst. I know that I work daily with benchmarks, national benchmarks comparing the E&Ms that the clinicians that I work with in the specialties that are meeting the benchmarks nationally for their same specialty. And once the computer pulls all of that for me, and then I know how to look at it and determine who needs to be reviewed so that I can go in and look at their documentation or their coding to see where the gaps are, or where maybe some knowledge needs to be imparted. Also, there's HIM managers. Now, I used to get a little confused because the hierarchy would be that, let's say in the coding, you would have a coder's role, and sometimes those coder roles would be divided up into different teams depending on how large of an entity you work with. If you work for a small practice, it could be just you, or you could be part of 30 coders, and they're divided up in different teams that do different specialties. And then after that, you would have a supervisor. The supervisor would, make sure that you were getting your work done on time, you were educated in any gaps that they saw, and that you're meeting your goals that they set for you. And then there would be a manager. The manager would be over that particular, say, team. And then you would have a director above that. So you could walk that ladder rung by rung based on your skills, your background, the education that you have, or how much time you have in the industry a lot of times. So usually when you deal with larger entities, there's more room for growth. When you work for small entities like a private practice, you just probably going to have lots of hats that you would do. Again, this could be in hospitals, you could be in clinics, insurance, government, software vendors is huge. I used to have them reach out to me all the time. Some startups where they had a great idea with, a platform that they wanted to market, and they wanted my viewpoint from a coder standpoint, or something else that they knew that I had done in the past. Does it look like what they show me is vetted, in other words? So that's just a few, by the way. Now, if you want career advancement that is getting up into like the director's role, you probably want to consider a degree. A lot for larger entities, especially, not so much for smaller private practices and things. They just want the work done. But for larger entities, there may be a necessity in that you have a degree under your belt. If that's the case, degree programs through HEMA are what you might want to consider. You can get a degree in health information management, and RHIT is an associate's degree. They think of it as the technical side, but again, it's an associate's degree. Now, with the RHIA, that's a bachelor's degree, and that will absolutely open the door for you to go into management. With that, you're going to have a higher pay scale. A lot of times with them, you could be salaried versus working per hour. You could, with any of these, though, you're probably going to start at entry level and then move into leadership if you don't have time under your belt in the industry. So I want to make that, I want to lay that down for you, because if you go and you get a degree and then, you hand them your resume and you've never worked in the industry before, except for, what you did to get your degree, then you still could be stepped over by somebody that has, 10 years in the industry doing the work, but they don't have the degree or the high degree that you have. So again, just be very aware of that when you think about the future of what you want to do. Put the pros and cons. Do you have to have a degree to get into HIM? You absolutely do not. If you have aspirations to get into management and maybe a directorship, then yeah, it's pretty much a necessity. Certifications that have degree programs that are the most well-known and recognized is through a HEMA, and that's an RHIA and an RHAT. They do a little bit with coding, but it's, I wouldn't, quite honestly, I wouldn't trust either one of those to be coders. They just are taught a little bit about it, but they're not certified coders. These are health information management degree programs. They do carry a lot of impact, though. Those analytical skills that I spoke about a few moments ago, these are things that I think personally you can develop in yourself, that you maybe don't need to go to a brick and mortar school to get these skill sets. One is problem solving. Now, when you get into the industry, there is just problem solving, is part of what we do, because you're always run up against a problem. I had a scenario today where it was an issue that it was brought to me. I wasn't able to solve it. I bounced it off my team members and everything. We weren't able to solve it because we all had a different idea of how something would work. And so we kind of benched it till we could get more resources in. So, but it is a problem solving job. The data analysis, this is where AI really, and the software that you use picks up plays a huge part, I guess is what I'm trying to say. So in stating that, the way this information is conveyed is through things like Power BI or Excel. I work daily in Excel spreadsheets. You don't have to take a heavy course in Excel to learn how to use the basics of Excel, but and there's all kinds of things like on YouTube where you can get really good at Excel. But I have to say, if there's anything I tell you that you need to get besides, say, getting a coding certification, the next number 2 thing is you better learn Excel. And when I say inside and out, because you're going to use it daily. And if they have to train you to use Excel, then you're not going to be on the top of the stack. Now, you will never learn everything about Excel. Today, one of my peers showed me something that I didn't know you could do in Excel. So you're constantly learning, but to know the basics and be able to navigate a spreadsheet and put the data in and manipulate it a little bit is necessary. Coding accuracy. This is basic coding 101. You have to be accurate because of what we do. We're held at a high level of excellence, usually a minimum of 95% accuracy. Now, most entities that you work for will have they're pretty gracious, especially in the beginning, and they want to see you achieve. So they will give you whatever tool you need or resources that you need and to achieve your goals. So if they're investing the time in hiring you, they're going to train you as well, say in a particular area that they need you to feel. So that being said, you do need to be able to select correct codes. You need to be able to take evaluation and feedback and be able to track your benchmarks that you're improving. The entity that I work for, their coders in the specialties, they're audited twice a year and scored on those, and their pay can be based on that and some other perks. But they're also outsourced, audited, and they're audited internally both by the team that I work on and their supervisors. So there's auditing of your work performance constantly. Now, if you can't adapt to that, or you get a chip on your shoulder regarding that, then you're not going to succeed in this industry. Everything changes so frequently, and we have to be adaptable. And another thing that I would say that I've noticed, because it just came up again, if you do work for an entity and everything that you've learned after you get certified, I mean, it's like being a high school student and you're a know-it-all. You are really proud of the knowledge that you've achieved. However, even though you've had these guidelines and stuff crammed down your throat, you may work for an entity that tells you have to code something a certain way because that's their policy. And it goes completely against everything you were taught. However, you have to remember you're an employee, and they may have a reason to have you do that they don't wish to tell you about, or they don't feel they need to, or for whatever reason. You can give them a rebuttal or articulate what your concerns are, but if they tell you to do that, then you do it. Because again, they may have a policy in place. So I'm not saying don't code accurately or go do something that is unethical. I'm just saying that they may have a policy that's in place. It's not a sword you want to fall on. So be adaptable, take feedback, and have a positive attitude when it comes to having yourself scored or continual training moving forward. One of the things that we look at and that we track is down coding, up coding, and just proper coding. And that's where they will get that 95%, and they will track you a lot of times both on CPT, E&M, and your ICD codes. If you down code, then who you work for loses money. It's lost revenue. If you upcode, then you're setting yourself up to an audit where the men in black that are paid to find mistakes are going to find something. And then with proper coding, then the services that are being rendered and the health of your patient population is all being captured accurately, and therefore the services that need to be performed for that community can continue to go on. Attention to detail is very important. Ensuring the accuracy of a record, not just the coding, but just the patient record. Now, Laureen and I come from a time where it was paper, and we used to have to carry around a record where, you'd have to go to Med Records and pull that record, and things were written by hand and typed up and so on. And maintaining that record was important. Now with everything being electronic, it looks different, but the content is still the same. And there's laws regarding compliance and privacy laws, HIPAA laws. You need to be well versed in HIPAA. And HIPAA is not just don't tell somebody about somebody else's record. It's much more than that. So you need to make sure that you're comfortable with HIPAA. No matter where you work, they'll make you take probably every year training in HIPAA. It's that important. If you have errors, that's going to affect both patient care and the reputation of an organization. So you will see a lot of times team building for both large and small entities that you may work with. And so that is something that is fulfilling in a job, because knowing that you're part of a team and you have peers that you can bounce ideas off of and ask questions off, you're not out there all by yourself, is extremely important. But then you also have to be open to working with different types of personalities. And so I would encourage you, one, to again learn more about HIPAA and compliance. And in addition, learn how to have organizational skills. Those are things that you can learn and get tips online, but also about personalities and how to work with personalities. Find out what your personality is, what type you have, and what type of environment that you work well in. And remember that when you're working for an entity, they're very proud and they want you to be proud. You represent them. Just another little commercial here. We have a fabulous course that started last year that would be an excellent resource for some of you to allow the providers to use the G0023 code. This is a service that's paid now for, that is more or less like a liaison between the doctor and the patient and all the resources that are available to them. The course, we called the course Qualified Patient Illness Navigator. The code that's billed is Principal Illness Navigation. This predominantly was used with oncology in the beginning, but now it's broadened, and it's for people specifically who have social determinations of health or brand new diagnoses that need assistance in understanding the disease process, or making sure they understand and have all the resources to treat that new diagnosis as it may or may change their life. So you work under the physician or a nurse practitioner, and it allows them to bill out 60 minutes every month for activities like doing an assessment with the patient, help them better understand via the information that the clinician or the doctor wants the patient to know, giving them the resource, and helping them work through high-risk conditions like oncology, a cancer diagnosis, but now it could be a diabetes diagnosis. It could be wound care with an ulcer. It could be maybe a new diagnosis that they've gotten for like MS or Alzheimer's and stuff like that. You actually get to again be that liaison between the clinician, and this course is pretty fast. We encourage, the course that we created is not a person that's never been in medicine before. It's ideal for a coder to pick this up, so that the entity that you work with can also use you in this role, and it encourages documentation and finding out what that patient needs that maybe they didn't have the time or they didn't think of to ask the doctor at the time. So again, you're that liaison. Did you want to say something about that?
I was going to tie it into the subject of the webinar tonight, that if you are already certified and you're looking to add something to your resume or whatever, this is a great one because you can do it really quick, and you now become a billable person on the team. instead of someone who's just processing and doing the coding. So this code, the G0023, has to be done by a certified person. So this course certifies you. So when you pass it, you get a certificate. So now you're a qualified individual for them to be able to build this code. They can't just bill it. You have to have someone who's been trained, and that's what this course will give you. So,
and another thing I'd add on to what Laureen was saying is this is a new code that came out last year, and it is picking up traction, this particular service. So I think we trained quite a few people, but small practices that see a lot of patients that want to be able to use this code to better to literally help that patient navigate the diagnoses that they've been given. They, as Laureen said, this gives you another rung on that ladder of being getting your foot in the door. And I think you're going to see it more often used or implemented once word gets out. New codes, new credentials and stuff. It takes a while for them to pick up traction. And I would say in the next couple of years, this will be pretty big. We have another area that Laureen, do you want to take this one?
Yeah, just real brief, because I want to keep us on track time-wise. So you might have noticed a different look to our slides, and we're using the name CCO Academy. We have a new platform. If you actually go to cco.academy, you can join it for free. And then, of course, if you're a club member, you get access to more perks. And if you're a student, that's where you're going to be doing all of your coursework now. It's very modern. It's very mobile. It works on your phone and your tablets. And I love it. So come check it out. And our YouTube channel name has also changed. So it's CCO-Academy. Someone already has CCO Academy, but for something else. But at any rate, so you'll notice those changes. We really appreciate word of mouth, liking and subscribing. That helps us so much. So we appreciate your support, and let us know what you think about the new look and theme and the new Academy app platform.
It is very user-friendly. And just to be able to open up your phone and stay on top of it, where you're at in your course and stuff is excellent.
And what we're doing with these videos is we are like the main topics, like this is a one topic video, but other ones where we do the Q&A, we might have 3 or 4 questions that we answer. We're going to be taking them and putting them up as their own little topics on YouTube. And then we're doing more shorts. So each of those topics will be broken up. So please subscribe and you'll start to see that more. And a lot of these, like this is a perfect like podcast one where you can just listen to. You don't necessarily need to see the slides, versus looking at an op report or something like that. So there's another slide coming up, I think, that talks about our different webinars that we have. Yep, this is it. So we've got the CCO Academy podcast, which is the first Thursday, and then the CCO Community Q&A, which is the second Thursday, and then the Club Continue Education webinar, which is the last Thursday. So 2 to 3 a month is what we're doing. So if you also join that cco.academy, we've got a nice calendar now. You can see everything that's coming up. You can pre-register, you can register ahead, and you'll get all the notifications. So check it out.
Yes, and next month we plan to do insights into specialty-specific coding changes at the end of the month. But it's exciting to know. Just think, CCO Thursdays. That's the night that works well for us and many other people. So if you're free on Thursday nights, you can join us. And if you're part of the Academy or the CCO Club, it doesn't matter. You'll always have that access. Another area that's incredibly important and really kind of is a step from what we'd already talked about, but communication and teamwork. One of the things that I every year I would try to pick something to improve myself with. And one year it wasn't in the communication, but it was personality types. And there's several different things where, what color are you? What animal are you? So on and so forth. There's a lot of things out there, but they ultimately kind of talk about the same thing. So I would encourage you to improve your communication and teamwork is to delve into that a little bit. There's books that you can get. There's stuff on YouTube that will help you with that. But if you understand how you learn, how you think, how you communicate with others, it will help you be a better team member. And the way you're going to advance is if you get along with other people in a team. Those people that I told you about that pushed back, if they were told they had to code something a certain way because that was the policy, the ones that were disgruntled and had negative attitudes, they didn't last long. I used to say that if you're in an interview and maybe you don't have as much experience as the other person that you're neck and neck with, but your personality is one that they know will work with the rest of the people in the team or in that office, they're going to hire you. If they think that you can get along with Ethel, who's been there for 20 years and gets her job done and knows how to do everything in the office, but she's a little salty, then, that's worth more than having somebody that has, 5 years more experience than you, but it seems to be, like a real anal type personality and everything has to be done a certain way. So again, make sure that you work on yourself in that way. Know that in our industry, we are constantly collaborating with clinicians. And when we talk about clinicians, we don't mean just nurses. We're talking about all of the medical staff, but all of the NPs, the PAs, and the doctors. You'll be working with IT. You'll be working with insurance, and often you'll be working with the patients themselves. So if you're naturally a salty person, you may not want to be one-on-one patient engagement. You may want to develop your skills that you'll be more in the back office. But understanding what your personality type is and how you work in a team frame and explaining that to your potential employer is ideal. Another area that I think is important is explaining complex info clearly, training and leadership communication. If you're able to explain something clearly, that's going to elevate you as well. For me, if it's an area that I know very, very well, then I'm precise in the way I explain. Now, I tend to delve and tell stories. If it is an area I don't understand, then I put a lot of fluff in. And so it's not, that may not be an area that they want me explaining. So being part of a team and understanding your pros and cons, what you can give to a team is important. But train yourself to be able to give those elevator pitches when needed. And that will make you a better, that will set you up for a leadership role. Technical skills and certifications, again, the RHIA and the RHIT we've talked about. Those are degree programs for HIM if you choose to go that way. There are certifications that are for compliance and auditing and CDI work, clinical documentation improvement. There is, you might want to get involved with them. You could also get EPIC certified or certified in some of the major EMR systems. Data security is huge right now, and legal compliance. So those are some areas I think that you should look at. And if you have the opportunity to tap into some free content, then do that. Leadership and project management. Not everybody is meant to be a leader. Now, that doesn't mean that you can't train yourself to be, But most people that have those leadership qualities have developed them. So you just don't come out of the box a leader. And some people, again, are more prone to having project management skills. Me particularly, I am not a good project management person. And that was identified early on. So I steer clear of those types of roles. I can be a help to a project manager. I'm very good at that. But as far as, can I do it? Yes, I can do it. Am I the best candidate for it? Probably not, because that's not my skill set. Now, other types of leadership roles, absolutely, I can do those. But identify what type of goal you have, what type of career area that you want to get into, and build those skills. Managing projects, teams, and changes in healthcare settings. There is constantly projects being done and new education that has to be done because it's a behemoth. It's always moving and changing. If you want to really get into something, go into like pre-authorizations or, that's always changing. Importance of adaptability and problem solving in leadership roles. I can be a problem solver, but I may not be the one to lead the project or be the project manager person. Am I adaptable? Absolutely. And it's not easy to become adaptable. You become more malleable and adaptable the more changes you've had in your life. So be open to that and learn from any changes that are given to you. Time management and organization is also a learned trait. There's a lot of excellent tools that are out there. These are not my skills either. However, I've had to train myself and use multiple resources in the past to get better at it. And there are tons of things out there that are helpful. Laureen is really good at these things, and she is very good at finding tools that allow you to be better in these roles. So, and part of that is just her doing research. So that is something you can do. Prioritizing tasks, meeting deadlines, and ultimately reducing stress, because this tends to be more of a stress level area in the healthcare industry, because we do have often deadlines that we need to meet. Always being adaptable and knowing that you will be a lifelong learner. Remember, I said earlier that, I work in Excel every day, and I'm really I think I'm pretty good at Excel. However, someone showed me how to do something on Excel today that I didn't even know was, something that could be done. And it was a little thing. So you'll always learn. One of the things that I think is beneficial is coming to webinars that CCO offers. That's going to be a lifelong learning, letting us tell you what's happening in the industry, or even showing you the webinars that we're doing in the future and dividing up and having, 2 to 4 a month, or you sending us information and saying, hey, I need more. I've done some research, but can you, flesh this out? Can you unpack this particular area and do a webinar on that? Embracing new technologies and evolving healthcare regulations. Not fearing AI is probably your number one goal right now, because everybody fears it. And I don't want that to be something that gives you stress. Also, eventually we'll be moving to ICD 11, and we shouldn't fear that. We should embrace it. So instead of being a naysayer, be an encourager and being on top of what's happening in the industry. Read articles, listen to podcasts, come to CCO, find out what's happening. Compliance and legal knowledge. Now, this I love. This is an area I do well in. Maybe not so much on like legal, but the compliance area of our industry is fascinating to me. And I love to do the research and learn about what's happening in compliance. And I pick up on things regarding compliance or might be a compliance issue. In doing so, you have to understand the federal and state laws. So you may live in one state, but you're working for another an entity in another state. And that's the beauty of being able to work remote. So you've got to adapt to different state laws. HIPAA and regulatory requirements there. HIPAA doesn't really change, but regulatory requirements do change often. And usually you can find what's happening very easily by just staying in tune to, say, LinkedIn, as well as there's a couple other like magazines and stuff that you can name us and or NAMUS and stuff like that that'll help you. Collaboration across disciplines is important because you have to remember you're not just a coder. I hear that from a lot of people. No, you're an integral part of a team that takes care of a patient population. And your role is huge in the network of what is done in medicine. Working effectively with diverse teams for seamless data flow and patient care. It's all about patient care. It's like when you go to church, they ask you what the Sunday school answer. It's always Jesus, right? When you go to get into healthcare, it's always about the patient. And you're an integral part of that if you get in the HIM world. Explaining complex information in training and leadership communication is also important. Now, you may not be in the beginning explaining complex information, say, how to get pre-authorizations on a new procedure that's being done for this particular healthcare entity. However, if that's the area that you go into, it won't be long before you can do that, because the longer you're in there, the more knowledgeable you become. And your communication skills, you can work on those. There are soft skills that you may or may not be good at. However, there are tons of resources out there, books, podcasts, but I would say YouTube has great soft skills. If you're curious, you can write into the CCO Club. I've got a couple books and organizations that I work with that I think are excellent to help you with leadership and communication skills. If you want to build up, this summer, your skill set, start your online courses, find out what certification is going to best suit you. It's really interesting. A lot of times people will get into, say, risk adjustment and say, hey, I really, really love this. And I'm fascinated with cardiology. I want to know more about that. What should I get into? And then we say, what, if you really want to become a cardiology coder, you need to pick up this coding credential and then pick up one or two of these. You can get into vascular or you can get into cardiology, but this is what resources you'll always need to be able to get into, and so on and so forth. Let us help guide you with those. If you want to get into management and eventually, say, become a director, then you're going to want to look at the RHIA and the RHIT, and they have preparatory skills that they talk about as well. If you go to AHIMA, hands-on practice with EHRs, you can go on and learn stuff on YouTube about Epic and Cerna, the two great big EMR systems that are out there. So that's kind of interesting. Networking and mentorship opportunities. Go to your local chapters. Don't just think about the AAPC. You have AHIMA, you have ACETUS, you have several organizations out there. If you want to know about some specifics, or you want us to tell you, if you hear about one and you want to know if we have an opinion on them, absolutely send a note into the CCO Club and we'll let you know what we've heard. Or we have a lot of friends in the industry that we can point you in the right direction. Those soft skills you always improve in. Now, don't feel bad if you say, I'm a real introvert and soft skills is not something I excel at. It can be learned. One of the things that is the hardest things that I had to learn how to do was that active listening, because I'm a talker, as you know. But there's ways to practice that. And I've got some good books, if you're interested in that you might find helpful in learning how to become a better communicator and improve soft skills. Fun and rejuvenating learning activities. Again, you there's some things that you can now get on your phone that help you become more in tune to details. But I would say not just cognitive skills. Be very leery of some of those that say improve your cognitive ability by using this app. Not necessarily. It might be just go get a Sudoku book, do some word puzzles, get a real puzzle, not one on an app, and exercise those little gray cells. I would, or just get out and take a walk, and don't have your devices with you, and observe your surrounding. You'd be surprised how that improves cognitive ability. So as we wrap up your path in a hot HIM career, it's important to know that there are essential skills and career opportunities, and that you will always be learning. You will always be getting better. Laureen and I both still think about certifications we may want to get or pick up, because one, we're either interested or we think that it might further our career, or we just want to know how to do something with, say, Epic, as I said. Excel, though, number one, get involved with Excel. If you have an area that you want to know more about and you would like us to do a webinar on it, very easy to let us know. All you have to do is go to the cco.us/topic-request. We will take our CCO Club members as priority. What they tell us that they want always gets, picked first. However, we do look at all requests that come in, and sometimes we'll combine several and say, hey, this is, we had 3 people ask about this. Let's do a webinar on that. So again, we're here for you, and we want to make sure we're giving you the content that you desire that will help you. Some testimonials as we wrap up. If you go to the cco.us website, the testimonials will pop up, and the 3 of them that were picked out. One is L. Knopf said, I took the physician-based course from CCO. I was able to pass my CPC exam on the first try. I definitely recommend this program. Tina Teasley said, you have to pay attention to the details. Process of elimination, tab your books, highlight keywords, and bubble. I love the BAT. I love what BAT taught me. And you know what? That BAT technique can be used for other things. Jamise Coleman said, OMG, this program has been so helpful in my studies, passing the CPC exam. As we, again, wrap up, I think that we really enjoy what we do, but we think learning is fun. We do education full time. And if you want to be a coder or get into the HIM industry, we're here to help you through that process. One of the things that we used to do that we're bringing back is if you've passed one of our courses and you give us permission to announce it, or you've passed your exam, we will list your name and the certification that you passed at the end of these webinars. So this is what it looked like, more from what we used to do. And you can reach out to us. Especially club members. We love announcing our club members. So stay tuned and to next month and see who passed. Anything you want to say, Laureen, wrapping up?
No, I think we're good. We touched on, I think, everything. And you talked about we were going to talk about the risk adjustment real brief.
Oh, yes. Real quick on risk adjustment. What's unique about risk adjustment is in the past, it used to be just inpatient that dealt in risk adjustment. However, risk adjustment truly allows the clinicians and entities to get paid large lump sums of money to take care of their patient population. Unlike what we do with Profi and other things, kind of in the trenches, they're paid, like as the checks come in. But risk adjustment is a big lump sum. So it's almost like being an auditor looking for ICD or diagnosis codes that carry this HCC. So you only work with one code set. You're working with risk adjustment HCC's ICD-10 alone. What you do need to know is disease process. You need to know pharmacology. You need to know anatomy and pathophysiology, because you're looking at the entire encounter and wanting to show that this diagnosis has been addressed, the diagnoses, say hypertension, and they take a particular medication for it. The great thing about risk adjustment is they're willing to take new coders. And a lot of times just getting your foot in the door is so hard, but risk adjustment is an area that allows you to do that. So I would encourage you that if you're stumbling over, where should I start? Look into risk adjustment. We have a fabulous course, and we have ancillary courses if you need those, like the ones I just mentioned, to help you over the hump to if you don't have any background in medicine.
Thanks, Alicia. And Alicia loves risk adjustment coding. So
very much so.
So yeah, good supporting her. Well, thank you, everyone. Thank you, Alicia. Very nice presentation. And thanks everyone who helped pull the slides together. We look forward to seeing you on a future webinar. So tell your friends, and we'll see you next time. Thank you.
Thanks for joining us, guys. Bye-bye.
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.